The cut looks small, but days later it is hot, swollen, and leaking beneath a crude covering. There are no antibiotics, sterile bandages, emergency rooms, germ theory, or trained surgeons waiting nearby. Survival begins by removing dirt, protecting the wound, and disturbing the fragile damaged tissue as little as possible. Then someone must return, replace the covering, bring water and food, and watch closely for worsening sickness. That repeated care may have mattered more than any single prehistoric remedy gathered from the surrounding landscape. A sharp stone can open skin during butchery, tool-making, climbing, fighting, or dangerous close-range hunting. The first danger is bleeding, but the slower and less visible danger arrives with contamination. Soil, saliva, dirty hands, animal tissue, and shattered material can enter the wound within seconds. Your immune system fights back immediately, producing heat, redness, swelling, pain, fever, and sometimes pus. Without modern treatment, infection can spread relentlessly through soft tissue, exposed bone, or the bloodstream. Yet prehistoric skeletons repeatedly show something remarkable. Many people survived serious trauma long enough for damaged bone to remodel. Healed bone does not preserve a perishable bandage, a washing technique, spoken instructions, or a healer's hands. It records the biological result, while almost every daily step in the life-saving process disappears. One Neanderthal from Saint Césaire survived a deep wound to the top of the skull in Ice Age France. New bone formed around the injury, showing survival for months rather than minutes, hours, or merely several days. The blow may have come from another person, but the long recovery tells an equally important second story. Someone with a severe head wound needed safety, drinkable water, nourishing food, warmth, and time away from danger. That makes organized care a practical technology, even when no wooden bowl, fiber pad, or hide dressing survives. The likely first task was simple but urgent: stop more dirty material from entering the vulnerable wound. Careful hands could remove visible debris, while the cleanest available water might wash away loose contamination. But archaeology rarely preserves that fleeting moment, so we cannot honestly turn practical plausibility into direct proof. A covering of prepared hide, plant fiber, clean moss, or another soft material could shield damaged skin from dirt and insects. The useful covering would need gentle changing whenever it became wet, visibly dirty, damaged, or painfully stuck. That is not one dramatic operation, it is quiet, patient, uncomfortable work repeated across many uncertain days. Enforced rest also costs the entire group precious food, mobility, warmth, labor, and protection from nearby predators. An injured hunter cannot simply pause the cold, hunger, competition, and animal danger surrounding everyone else. Companions may need to slow essential travel, share scarce meat, maintain fire through the night, and guard the camp. This is why healed trauma can reveal cooperation, planning, and social organization, not merely an unusually tough individual. Some Neanderthals apparently lived for years with serious injuries or disabilities that sharply limited fully independent survival. Their continued lives imply repeated accommodation, help moving, specially prepared softer food, physical protection, and regular attentive assistance. Plants at a tempting clue, but this fragmentary and easily exaggerated evidence needs especially careful handling. Neanderthal dental calculus has preserved microscopic chemical traces linked with bitter yarrow, chamomile, and poplar. These plants contain natural compounds now associated with anti-inflammatory, pain-relieving, or antimicrobial effects under particular conditions. But finding a plant in the mouth does not prove how, why, or where ancient people deliberately used it. It might have been ordinary food, flavoring, accidental environmental contamination, or medicine intended for an entirely different problem. The honest scientific answer is not that Neanderthals possessed a powerful secret prehistoric antibiotic lost to history. It is that close observation and shared experience could preserve genuinely useful habits without anyone seeing or understanding microbes. If one particular leaf eased pain, reduced swelling, or seemed to improve survival, observant people could remember it. That practical knowledge could move across generations through careful demonstration, imitation, correction, and memorable stories around the fire. The most astonishing surviving case comes from a remote limestone cave in tropical Borneo, 31,000 years ago. A young person's lower leg had been deliberately removed, not crushed by an accident. The bone healed, and that person survived the operation by 6 to 9 years. In a tropical environment, uncontrolled bleeding and infection should have been enormous dangers. The survivor therefore needed anatomical skill, careful cutting, blood control, and long postoperative care. Researchers cannot identify the exact tool, dressing, antiseptic plant, or person responsible. The healed limb proves success, while the missing details keep the story scientifically honest. Not every wound healed. Archaeology naturally preserves survivors more clearly than failed treatments. Many infected people would leave no distinctive mark if death came before bone changed, so the record is biased toward the rare bodies that endured long enough to recover. Even those survivors were not saved by toughness alone. They were saved by a chain: control bleeding, reduce contamination, cover, rest, feed, and return. Some links are inferred, some are supported by plant traces, and healing proves the chain sometimes worked. Modern antibiotics transformed the odds, but the older foundation of wound care remains recognizable. Clean the damage, protect it, monitor the body, and do not abandon the patient. The deepest prehistoric medical invention may not have been a drug or stone blade. It may have been the decision to come back tomorrow and care again.